My name's Rachel Quintanilla. I'm the Chief Behavioral Health Officer for Project Vida Health Center. Being in a border region, access is one of the very difficult parts of our population getting behavioral health treatment, transportation assistance, the legal status, the people that live in the areas that we serve. There's a shortage of providers and insurance. A lot of the people that we serve don't have insurance. I would say all of them. All of them are. But the elderly, when someone in our elderly population cries out for help, it's because they've waited so long. And by the time that they are asking for help, we need to respond. We need to respond right away. Our children, that's a highly vulnerable population because they've got academics to deal with. They've got peers that they have to socialize with. They've got so much pressure, and we need to take care of them as soon as we possibly can. So, in essence, all facets of life, bring different needs and different stressors. We just try to respond as best as we can. One of the things that we do is that we've got care managers that are placed at each one of the clinics that assist our professional staff. And we've got a tremendous outreach program that goes out to the community and informs the community about the services that we provide. We are very pleased that we're bringing a psychiatric residency program to Project Vida that's going to train on new psychiatrists on how to work in community, how to work in an integrated system, how to work with partners, and that hopefully they'll want to stay in our community and continue working within, if not this community, other Hispanic communities throughout the country. I recalling particularly a lady just walking aimlessly down the street by one of our clinics, and she decided finally to step in and just ask if there was any help for her, and she was suicidal. And she came in, and our front desk staff immediately contacted me, came out and greeted her and brought her into my office and started talking to her. And she was so desperate for it. She didn't want to harm herself. She just didn't want to continue living the way she was living and suffering the way she was suffering. It was wonderful to see that she went back to her profession. She made amends with people that she had broken ties with for fear of being judged. She had an aura of self-confidence that I will never forget. Well, like I said, it makes a huge impact when people donate. It makes a huge impact because the more donations that we have that can cover those things that our grants and our federal funding don't cover, the better that we can dedicate time and resources to those patients. Yet monetary donations, it gives us the ability to cover those areas that are not covered in any other way.